Dumb question, but is it showing like a normal presentation?
Yeah.
Okay. All right.
Do you want to make a little disclaimer real quick too for the people who just joined? We're probably going to go ahead and get started, I think, Cassandra, right?
Yeah.
So if you guys have any questions, feel free to put them in the chat. We said that earlier, but just for the people who are just joining, go ahead and put them in there, and we will try to answer them as we go.
Okay. All right. So for those of you that just joined, we are current nursing students. My name's Cassandra, and then we also have Bailey, Holmes, and Holly over here. We're currently in the program in the second year, and we decided to put together this presentation for a couple reasons. Like I said, we're currently in the program, so we were once in your shoes and knew, just how many questions you have as new students waiting to get into the program or taking prereqs, and knowing what you need to take, what the admission process is, but then also once you would start the program, what it looks like. So we are currently in our childbearing family unit, which is our Nursing 200 class. It's the first class of the second year. So after this class, we'll be on to the number 6 of 8, almost there. We'll be finishing in July. But the 3 of us were all invited to Alpha Delta Nu, which is the Nursing Honor Society. And students with a B average or higher in nursing coursework only, at the end of the first year of the program, are invited to it. And in order to be inducted, we have to complete a project. So a lot of projects are just volunteer based, so we can do something nursing related. And we kind of got together and thought about just the struggles that prospective students might be having, just in whether or not they want to start the program at this point in time, especially with COVID going on, and hopefully relieving some of that anxiety with maybe applying at this time and seeing what different questions you might have now versus, last year before all of this began. So that's why we're putting together this video for you. Like I said, we're all in the program, and all 3 of us do actually work in healthcare at the moment. I'm an ICU CNA at Morris Hospital, which, if you don't know where that's at, it's like 20 minutes south of Yorkville. Bailey is a PCT at UW-Madison. She's actually driving back and forth every week to work there, so
I used to work at Rush. There's a method to the madness. So there's a lot of hospitals that'll do like nurse residency programs, and pretty much the only way to get into UW-Madison as a new grad nurse is to do the nurse residency program, which is why I choose to commute to Madison for work. So just to explain, not that I couldn't find a job in Illinois.
It's not just for fun.
No.
And then Holly is an OB tech at Valley West. And if you guys have questions too as we go on and just want to ask us even about our jobs, we'll be happy to kind of give you a little insight of what we do, if that's something that you're interested in getting more involved with, especially early on in the nursing program, just to get your foot in the door with the hospital or to get more hands-on experience too. All right. So as I mentioned, we just kind of put this meeting together to answer some of these questions, talk to you about, what you're actually going to be studying in the classes, what our schedule looks like week to week, how COVID has changed our classes. And then I know for me, at least, I was wondering a lot of what I should review from A&P, or if I needed to really, actually remember certain things versus just know it for the test and forget it later. Because I know I'm not the only one that did that. So hopefully we can answer some of that for you. Our first thing I want to talk about is just why choose Waubonsee. If any of you are here and are like deciding between a 4-year program versus Waubonsee's program, I think all 3 of us will definitely say go for Waubonsee's. It's much cheaper than a 4-year school, obviously. Like, that's the #1 reason most people go this route. But especially at a time where most lectures are online anyway, or most schools aren't having, you know, new students on campus, where you're not kind of getting that on campus feel either way. So, and there's still the camaraderie of our cohorts. So part of Waubonsee's program is it's set up so that you start, you know, if you start in January, you're going to have the same class of the same, you know, 20 to 30 people throughout the entire 2-year program. So you'll really get to know your classmates. You'll have the same people in your clinicals. You'll have the same people that you can study with. And it makes it really nice to just have people to rely on all the time for every class. I know with some 4-year programs, you would have 3 or 4 classes at a time, and they might not be in the same order as, you know, your friends or somebody else that you've previously had class with. So it makes it nice to know you're always going to have the same people. And along with that too, Waubonsee's setup is so that you only have 1 class at a time, and each class is 8 weeks long. So even though the classes are very condensed, you only have to focus on 1 particular class at a time. You don't have to worry about juggling 3 or 4 that you would at a bigger school. Our clinicals currently at the moment are mostly in person for most classes. I know the very first class, our Nursing 105, is, I believe, still doing just skills lab and sim lab, just because that's essentially our CNA class, where all the clinicals are within like a nursing home or a rehabilitation facility. And most of those facilities aren't accepting students at the moment just due to the high risk of COVID. But for the most part, most other clinicals are having in person, at least to some extent. Along with that, our NCLEX pass rate's above 90, which is always a good thing. In case you don't know what the NCLEX is, it's the licensure exam that you take at the end of the program to actually get your RN license and be able to work as a nurse. So knowing that, you know, 90% of the time people from our program pass it's always a good sign. Our flexibility, so like I mentioned, only 1 class at a time, and our classes are laid out. So you usually have about 3 days a week of actual course commitment. So we'll have 2 days of lecture and usually 1 day of clinical. And some of that fluctuates depending on what class you're in, what time, you know, if they have extra skills that you need to learn and go to the lab for, but that's the general layout. And we do have the flexibility of starting 4 times a year. So they do have in August, October, January, and March start dates, which also allows flexibility too if you have a situation where you need to withdraw from a class due to, you know, personal situations, medical issues, or just struggling with the class for any reason. You can pick it up in the next quarter. You don't have to wait a whole semester or even a whole year before starting again, which some 4-year schools will do just due to the way that their programs are laid out. Waubonsee is very reputable within that community. Actually, just over the weekend, I was talking to a student from the St. Francis nursing program. She was doing clinicals at my work. And I told her that I was a student at Waubonsee, and she's like, I have heard amazing things about their program. And that's coming from a student at a whole nother program that's, you know, a 4-year school. So, and I do know schools like Rush Copley and Del Nor and Mercy will say highly rate students that come from Waubonsee's program too, as new grads. And lastly, for why you should go to Waubonsee, we, and just in general, associate degree programs, is that there's a lot of RN to BSN programs available. So if you're planning to do a BSN, which everyone highly recommends, most hospitals, if you are hired as an associate degree nurse, they will offer tuition reimbursement for your RN to BSN. Some have partnerships where you can get 25% discount on tuition if you're going to a certain school. And then some hospitals will even pay it completely in full. So if you can get any kind of tuition discounted or get it covered completely, that's always a good thing. So, and I know Waubonsee did just start a partnership with UIC and their RN to BSN program. So you can be kind of enrolled in both to have a dual enrollment and make sure that you have all the non-BSN courses covered between, you know, our RN classes, gen eds, all of that before you would start at UIC, or the same with Governor's State. We've had a partnership with them for a while as well.
And Cassandra, real quick. I was going to say too, I noticed in the chat someone had asked about hands-on experience and working towards nursing. Along with what Cassandra said, I know for the hospital that I work at, which is through Northwestern Medicine, not only do I feel like working as a CNA or somewhere in healthcare before the program was amazing, it really helped me in the classes, but they did also offer the tuition reimbursement. So I have been able to get even the 2-year schooling through Waubonsee paid for. So that's extremely helpful. If you can find a hospital that is offering that, I would say it wouldn't hurt. I mean, you're going to get the experience for nursing school and you get reimbursement as well. So if you can find a hospital that offers that now, a lot of those hospitals also do offer that opportunity for you to transition from the RN to BSN program. Really, it's just going to require a little bit of research before, you know, you decide where you want to go or what you want to do. But I do know that Northwestern is looking for a lot of employees right now. So if anyone's interested, you can go on the website, just type in like the location that you would be interested in, and that would be an option. Also, someone else just asked, how and when did you get your CNA? And I got mine in high school, but I will say that as part of the nursing program, after you finish the first class, is it, guys, that you are able to work as a CNA. So if it's not an option for you to get your CNA beforehand, that's an option that you have once you enter the program, which is a great perk of the program as well. So
I want to say that Rush also offers tuition reimbursement. And if you are starting the program soon and you want to get your CNA and start getting hands-on experience, I'd probably just wait because you're paying for that first class anyway. And after the first class, you can sit for the CNA exam and get your license.
That's what I did. So I was not a CNA before the program began, and I got my the CNA certification after Nursing 105, and then I've been working in a hospital since then. And like she said, I wouldn't, if you're planning on taking the nursing program and starting soon, don't spend the extra money to take the CNA course. Just wait for your fundamentals class because it's the exact same material and then some. So just kind of wait it out. But most hospitals, I feel like, have like a 6-month grace period from when you start before they'll start doing reimbursement. So that is just something to keep in mind. I know my hospital is like that, where you have to be there for 6 months before they'll start any kind of tuition reimbursement. The way that I have my screen set up, I can't see the chat box, so just let me know if something pops up, guys.
You're good. We'll try and answer as you go. So,
all right, cool. Okay, so the admission process, I'm sure a lot of you have probably already looked into it if you're at this point in the state, in the game where you're in anatomy and physiology or in micro. But just to go over in case anybody hasn't been familiar with it, there's no automatic admission to the program once you've completed certain classes. You have to submit a separate application. And those applications are generally a few months before the start date. So I know the January start date application was due in October, and I believe usually the March start date is due in January. So it's mostly set up like that. And then you'll find out after you submit the application. I believe I found out about 6 to 8 weeks afterwards, I want to say. So I have listed here the prerequisites that are required for just applying to the program. If you haven't completed these, then you don't qualify for admission. So just make sure that you have them all completed with a GPA overall of 2.7 or higher in these classes. Another requirement for applying is the TEAS exam. It's a standardized entrance exam for the program. You need a 58% or higher in order to be considered for the program. And it does cost $72 to take through Waubonsee. And you sit, if you've taken like an ACT or anything like that, it's very similar, but it's on the computer. It just has a set number of questions, a set, certain topics of English, science, that kind of thing. And based on your score, that just kind of shows where you stand as far as your knowledge base in those topics, how well you would do in the program. We'll talk about this a little bit more later, but one of the tools that Waubonsee uses is a program called ATI. And your TEAS exam is actually connected to ATI, and it'll give you the percentage of likelihood that you'll pass your NCLEX based on like how well you did on your TEAS testing too. So it kind of just gives you a baseline before the program, and then as you take more exams throughout the program, that alters that percentage. But yeah, and then I added just at the bottom, actually I think it cut off a little bit, but I know a couple of us here did utilize the library to study for this. They have review books specific to the TEAS that will kind of specify how many questions are science, anatomy, and physiology based, how many are just general science questions, how many English and comp questions are there, stuff like that. So I found it really beneficial because it also helped me review math that I hadn't seen in a couple of years. It had been a few years since I had taken a math class. So it was nice to just get refreshed on that before I took my test.
Yeah, I know a lot has changed with the library recently, like in the last few days, basically. But I highly recommend taking out that TEAS book instead of trying to buy it, because I think it's like $50 plus to buy this TEAS book. And you can take it out for a week at a time and just kind of do an overview review of what you need to know for the TEAS. And you only 58, so.
We've got a couple of questions in the chat about the TEAS exam. Do you want me to give you those, or do you want to review all that at the end?
Yeah, we can go over it while I'm already here.
So it says, how do you schedule the TEAS exam?
So I believe with scheduling, you actually had to call and set it up, at least back when I did it. I remember right.
I think I just went to Waubonsee and told them I needed to take the TEAS, and then
walking in.
Yeah, you take it through the testing center there, and they'll just kind of give you a date and time, I believe, and then you come in and take it. So I would contact maybe the testing center, and they could probably give you a little bit better information about that.
And I'm not sure what they've changed with COVID. Right. I'm not sure with that specifically. But yeah, I believe when I did it, either I walked in and set it up or I called them to set it up. But they had pretty open availability as far as going in and doing it.
Someone else asked, if I need to be in the nursing program by October, I have to take my TEAS exam by March. Oh, I have to have my TEAS exam done by March?
You would just need to have it done before you submit your application, I believe. Maybe is Laurel still here? She might have a better answer on that, but I'm pretty sure that that's what it is.
Actually, I'm going to check with Margie on a couple of those questions because she's the one who works with it, the program director. So I'll see what she says.
It's so helpful to have Laurel here.
It is.
We'll see.
And as far as, so we'll work on answers to those. And as far as how long, to study for the TEAS, I don't feel like I studied for that long for it. It was a lot of review of stuff that I kind of learned in high school. So
I spent maybe just a couple of nights, maybe a couple hours for 2 nights beforehand, just more as review, just to refresh on those topics that I hadn't reviewed in a while.
It's helpful when you're coming fresh out of A&P and bio because it is very heavy on those subjects, obviously. So every test is a little different with what you're going to get on it. But I agree with them. I only studied for, a handful of hours, and it went okay. So
now, granted, if you're somebody that struggles with math or even with just like English topics, like I know there was a lot of questions that were, I'm trying to think, like the English questions were a lot of reading and then taking that and answering a bunch of questions about it. So if you're not that fast of a reader, that's just something to keep in mind. Or if, like I said, you struggled in math, then definitely spend a little extra time reviewing that. Because I know I put this 58% score on here. So there's 4 different subject categories that you will technically take the test for, and you have to score 58% in each of them, and then a total score of 58 as well. So that's just something to kind of keep in mind if there's a subject that you really struggle with.
I think the last one about the T's was, can you take it anytime?
I believe so. I mean, within the testing center, I think it's just like normal business hours. But as far as like before you apply for the program, you can take it anytime. But I would say if you can hold off until you finish A&P and micro, I would do that, because like Holly said, it's very heavy with those types of questions. And that's one of the subjects that I would say you should try to do well on, just because nursing is a very science-based area.
So it looks like Bailey got the information in the chat. You want to read that? I just called Margie, and that's what she was saying.
So it's March 15th for the application is due March 15th for August enrollment, July 15th for October enrollment, October 15th for January enrollment, and December 15th for March enrollment.
Yeah.
Perfect.
Thank you for doing that. As long as you take the T's before that application due date.
Yep. And I'm gonna one last note about the T's. I'm terrible at math, and I just did a little reviewing on the math stuff, and I did okay. So you can do it.
And then last thing too, Yolanda, I know, asked about, will they consider my entry to the program if I've passed the T's and I'm in my last prereq course? Yes, that's what happened to me. I was, it's kind of like almost like a provisional or whatever you want to call it. Like they'll wait for you to pass that last class. And then if you do pass that class, Laurel, is that correct? Then they'll send you your acceptance as long as you pass. Okay, perfect. All right. Are there any nursing classes in the summer? Yes, and we'll kind of get to that. I'll let them go through the scheduling of the classes a little bit and how it's laid out, and we might touch on that. So Cassandra, if you want to.
So my next 2 slides just talk a little more in depth about the classes and how they're divided up. So like I said, the Nursing 105, which is the first class, that starts in August, October, January, and March. There's that class starts 4 times a year, and then all the other classes kind of follow along with that. So along with the question of the summer class, at the moment, as far as I know, there's only 1 class that gets taken over the summer, and that is the very last class, which is Nursing 275, and that's for students that start the program in October. So that way you don't have to wait until December to graduate and wait through the whole summer again. So that's the only one that does get taken over the summer. Otherwise, all the rest are just August through May. And I'll just kind of go through this quickly here. So over the first year of the program, it kind of just focuses a lot on the basics of nursing. The Nursing 105 is actually called Fundamentals of Nursing. So it's like we mentioned before, it's the CNA class. After you successfully complete this, you can sit for the CNA test. But it's mostly vitals, activities of daily living, safety, infection control, all those kind of the basic concepts that they want to make sure that you know just going into a hospital setting. After that, you'll go into mental health, which is, as it says, mental health. You just talk about psychiatric disorders and the interventions and how to care for the behavioral health, mental health patient. Because, you know, when you think of mental health nursing, you think, oh, inpatient psych or outpatient, but in reality, you see these patients even in the medical setting too, on a telemetry floor or on a med-surg floor. You're still going to care for somebody that is going through withdrawal or that has depression and anxiety or even bipolar. So being able to communicate with not only a normal patient, but also somebody who's going through all these other issues is very important. So that's why this class is so early on in the program, because they want you to be able to communicate at all levels with the patient. I did make a note here. One of the clinical options for there, I'm not sure if they are still doing in person or if they're one of our limited ones due to COVID, but they do have a forensic treatment facility option for mental health, which I honestly really enjoyed. The forensic treatment facility is, so all the patients are ones that committed crimes and were deemed not mentally competent to stand trial. And so they are within this facility, and it was very interesting just seeing not only the psychiatric side of it, but seeing also the criminal justice side of it, like what their crime was, what they were charged with, and kind of seeing the process of their sentence, if you will. So that was
a really cool opportunity.
Yeah, that was a little fun tidbit there. So after that, the second half of the first year kind of jumps into basic concepts and med-surg. So you'll talk a lot about oxygen, pain management. You'll start doing a lot more assessments. The physical assessment is a big thing, and you'll learn how to insert a catheter and insert an NG tube. And for these two classes, the clinicals are in person, and they have been doing them on med-surg floors of hospitals. This Nursing 120, I know it depends on how big your class is. For ours, we have a smaller class, so all of ours were luckily on a med-surg unit, but I know some of the bigger classes had options that previously were in like a skilled nursing facility. And so if your class is a little on the bigger side, it might vary, but that's just info there. So yeah, that's the first year. Second year dives a little more in depth. The class that Bailey, Holly, and I are currently in is this Nursing 200. It's essentially what people would call the mother baby unit. So we're studying pregnancy and women's health and development of the well child. And we did our returns on pediatric injections, and our clinicals are currently in a labor and delivery unit. But after this, we kind of dive full force back into med-surg and ICU for the rest of the year. We'll cover learning how to start IVs, IV piggybacks, IV push, and most of our clinicals will be back in med-surg or the ICU type units. And they get a lot more in-depth as far as anatomy, physiology, pathophysiology within that as well. So one of the big questions that I had, I just thought of while I was talking actually, before I started the program, was the concern that there's not a pathophysiology or a pharmacology class specifically. And so I just wanted to mention, because I know some people were worried about that within my class. And since it's only one class at a time, everything is built in as you go. So if we look at like Nursing 205 here in concepts, which is Laurel's class, ironically. But so you'll not only study the pathophysiology of all these different types of systems and the disorders, but you also learn the pharmacological impacts and treatments that you would use for those. all within the same frame. So it's nice that while you're studying, you know, one system, you're learning all about that system instead of, you know, I had a class last year where I learned, you know, I learned pharmacology for cardiac disorders last year, but I don't have my cardiology unit until the end of the second year, which happens at a lot of four-year schools where you have, you know, a year delay between learning the pathophysiology and actually learning the nursing interventions of it. So that is another good thing about Waubonsee's program, is it's kind of all condensed so that you're learning all about one topic at the same time.
Cassandra?
Yes.
Oh, actually, go ahead. Go to that next slide real quick.
I was going to say, you guys can take over.
Oh, I was going to say, someone asked a question, but it kind of goes into this, Bailey, so maybe you can answer as you go.
Yeah, so somebody asked if how many classes you take every year, basically. So it depends on when you start. Like, for example, we started in October, so our first semester, we only had one class, one 8-week course, because we started in like the middle of the semester, basically. And then for our last semester in the summer, we'll have just one class, and then we'll be done. So it's 2 classes per semester. Each of them are 8 weeks. So theoretically, yeah, you would take 4 classes each year. But sometimes, you know, when we have so many start dates, it gets a little bit thrown off as to exactly how many classes you're taking per year. But there are 8 courses total in a 2-year program. So, yeah, I hope that kind of answers that question. But like she said previously, so there's 1 course at a time, and each of them are 8 weeks. And then usually it's 2 days per week of lecture. Every class that we've had so far has been 2 days per week of lecture. And now with it being online, it kind of depends on the instructor. The instructor for a class we're in now has pre-recorded her lectures and just expects us to listen to them and take notes on our own time. And obviously you can do that during the scheduled class time if you would like to, but she does like a review session during one of her lecture periods. And then other instructors are having us log on to Zoom like concurrently as they're lecturing instead of recording them. So typically 2 days per week of lecture, and then 1 day per week of clinical. There's a couple of courses where we've had the option to do 2 days a week clinical. I think the first course they had one where it was, is that incorrect, Laurel?
I don't think we're going to be able to do that again. I think we're
Okay.
going to have to stick to the 1 day.
Well, not anymore. So now it's just 1 day per week of clinical. And it depends on the hospital's rules. Like right now, the hospital that I'm at there's only 3 of us allowed on the unit at a time. So there's 6 of us in total. So 3 of us go on the unit for half the day, and then 3 of us work on like clinical paperwork during that time. So it depends on the hospital's rules, and of course it's at the hospital's discretion to decide if they're going to have us or not. So it is possible that we will not be allowed to go to the hospital for clinical anymore at any point, because it's up to the hospital. It's not up to Waubonsee.
There was one thing I wanted to mention about the 2 days a week. The very first week of each class, we have 4 days a week. Yeah. So very first week of the 8 weeks, we do one whole module in that first week. So Monday through Thursday or Tuesday through Friday, for each class we do 4 days, and we just kind of jump start that class.
Mm-hmm.
I just wanted to mention that.
Yeah, exactly. The first week of each class is every day we have lecture. And then there's typically a quiz the following week. So back when we were in person, we had typically an exam every other week. But now online, it seems that all of the instructors are doing a quiz every week. So less information, but also less time to learn the information. So you've got to stay on top of your studying and stuff. Like the PowerPoint says, we do get to submit our preferences for clinical days depending on when you work, but it's not guaranteed. So you could get your 4th choice, or you could get your 1st choice. So kind of be prepared to be at least a little bit flexible as far as work and everything goes. And then of course you can switch with people. So if you really run into a problem and have an issue with the clinical day that you've been given, typically the instructor will allow you to switch with somebody else if you really need to have that day free. And then we have additional days where we'll have skills lab or a sign-off or simulation, depending on the instructor. It's a little bit different depending on each instructor. Skills checkoffs, we typically will go in and meet with a fellow student and go over the skill with a student and have them sign off that we've basically studied and practiced it. And then you test off that skill with somebody who works in the skills lab. The grading scale is a little bit different for the nursing program than it is for anywhere else at Waubonsee. As you can see there, 92% and up is an A, and then after that, so on and so forth. You do need an average of 80% on your quizzes or exams to pass the class. If you do not have above an average of an 80% on your quizzes, you have essentially failed the class and you have to retake it. So that's something to keep in mind too. Yeah, so I guess we can go on to the next slide unless you guys have anything to add about that.
Bailey, someone asked, how packed are our schedules? Is it hard to balance working and school?
I will be honest, for me, yes, it is hard to balance working and school. We all work night shifts, right?
I work evenings.
Yeah, I work nights.
Well, one of the benefits to working nights or evenings is, for me at least, at my job, usually patients are sleeping for most of the night. So I do have a little bit of downtime to kind of crack a book here and there, but it's not a guarantee. And there's downsides definitely to working night shift. But yeah, I'd say my schedule's fairly packed.
If you have the opportunity to get a job that's an evening, like I work at 3 to 11:30, and honestly, it works out really well because all of the at least the scheduled lectures are either 8 to 11 in the morning or noon to like 2:45. So even in our afternoon schedules, I can go and sit in that lecture, now that they're virtual at least, sit in a lecture while I'm at work, and then just hop on the unit right when my shift starts. So that works out nicely.
Sorry, random question. I was curious, are you guys working PRN, or do you guys actually have a set schedule for work?
I'm working part-time, so I do an average of 40 hours every 2 weeks. So with mine being my shifts are 8 hours. So I do 3 shifts one week and 2 shifts the next.
I'm also pretty similar. I work a part-time job nights. I also work, just applied for a PRN job as well. The only thing you really should be mindful of is that your schedule is changing every 8 weeks. Those lectures aren't going to fall on the same days every 8 weeks. So you just have to be mindful of that. If you don't already have an employer who is flexible, you have to make sure that, you're going to be able to mesh that schedule with your work schedule. So
exactly.
I also work part-time 2 nights a week.
So part-time is feasible just with good planning, being diligent and not slacking off. So
I do have students who work full-time though. I've had students who work full-time. One of the things that we do as instructors is we get a preference list. So before you come to our class, we give you a list of the different times when we think we're going to have clinical. And then if you have a certain situation where you have a certain work schedule, we try to work around that if we can. So that's one thing we do try. And there are students that it's very difficult to work full-time, but they do. So
yep.
This is my cat. He helps me teach class.
When they schedule you for your clinical, do they also schedule you for Saturdays and Sundays?
Sometimes.
Depends, yeah.
We haven't had it yet, but if they need to, and especially I feel like with COVID times right now, if that's when they can get us in, then it might be what we have to do.
And that is so what I mentioned earlier with like having a big class versus a smaller class, the smaller classes will be less likely to have like those Saturday clinicals because it's all based on how many people they can get into the clinical sites. So for example, if you're wanting to start the program in August, your class is going to be a big class just because everybody wants to start in August and have that just like set time frame and having all the classes be how they're meant to be set up within the 2-year span. versus if you start in October, like our class currently is actually like 12 people less than the August class. So our clinical options are a little bit more flexible just because we don't have as many people to work with. So that's kind of just something to keep in mind if you're starting and you have the ability to start in like October or March. You might have the smaller class and might have a bit more flexibility with your clinical options.
And that goes, someone just said, what's the biggest and smallest classes you've been in? Usually it stays pretty much the same because you're following with the same group of people throughout. It might change a little bit just depending on if there's a course that maybe someone doesn't do well in, or they have to drop out due to like specific circumstances, and then they're going to start up again the next time. It might change by like 1 or 2, but I think ours has sat around what, like 20.
18, 19,
ours
20.
is like 18 or 20 right now.
Oh, it's 18. Okay. So
and
yeah.
then I think the class ahead of us, so what would have been the August class, they started off with 36.
Okay.
So the smallest class we've had has been 9 students, and the largest class we've had was 38 over the years.
Perfect. Thanks, Laurel. All right. Bailey?
And I was going to also add to, you can go to the next one, it's okay. I was going to add to that as far as withdrawing or failing classes, you can withdraw, tell me if this is incorrect, Laurel, by the way, you can withdraw from 2 courses and you can fail 2 courses before you have to completely restart the program.
Right, you can withdraw twice, and then you can fail once, and the second failure, you're done with the program. So you can fail 1 time, and the second one, then you're done. You'd have to start again.
So
from the beginning.
Of course, you are welcome to start again. I mean, it doesn't sound like.
We do have somebody in our class currently that has started the program over again. So there's definitely people that do it if you're very committed to a career in nursing.
So as far as other things to know, as far as like expenses and things go for school, obviously there's upfront costs other than tuition. Textbooks every 8 weeks. There may or may not be new textbooks. Some courses use the same textbook. Like for example, we've got one big, huge med-surg textbook that we've been using for quite a few of our classes. Mother Baby, for example, we have a textbook that we only use for this class. We're probably not going to use it again. There is something called ATI that Cassandra mentioned earlier. It's how we do our homework. There's a lot of like simulations and things that we do. And it's also how in most of our classes we take our quizzes is through basically a program called ATI. It's also going to be how we prepare to take the NCLEX. That is $275 every 8 weeks plus taxes. But of course you can use if you've got like scholarships or FAFSA, you can use that for the ATI. But I do find it very helpful, and a lot of people say that ATI is harder than the NCLEX, so it will prepare you very well to take the NCLEX. You obviously have your scrubs and your scrub jacket. Right now we are doing black pants with the embroidered scrub top and scrub jacket. You only need one. You don't need to have multiple pairs because you're only going to clinical most likely once a week. And then as far as supplies go, you will need whites, or are they doing black now too, leather shoes? I think they're allowed.
Black or white.
Black or white leather shoes with no holes, no mesh, none of that, because in nursing, you're gonna spill things on your shoes. Or for example, if you drop a needle on your shoe, you don't want it to go through the mesh. So we have leather shoes that are black or white and plain, no other color. You obviously are gonna need a stethoscope, a gait belt, pen lights, and well, those things all now are coming in the lab pack, right?
Yep. Yeah.
Okay, so we buy this bag that's got all of our materials for lab for the whole program now. It's like a little backpack, and that has a pen light in it. I'm pretty sure it also has a gait belt. The only thing it doesn't have is the stethoscope, which I would recommend seeing if you can find a place that will allow you to test some stethoscopes. For example, the scrub store on 59 has where you can kind of test out the stethoscope and see if you can hear with it. Because if you've never used a stethoscope, sometimes it can be kind of hard to hear. Like, for example, we've got these isolation stethoscopes, the yellow ones. I can't hear anything with those. So before you commit to buying a $100, $200 stethoscope, I would recommend figuring out if you can try it before you buy it. Yeah, you'll like that. We talked about that backpack for skills. And then throughout the rest of the program, because they're having you buy that backpack when you start, you're not going to need to purchase other things for skills. I talked a little about ATI on how we do homework and take quizzes. Obviously, it's necessary to purchase the ATI. And then when you purchase the ATI, you will also get this big stack of books. I wish I had one near me to show you guys. I could go get it. It's only in the other room. But there's these like paperback books that are from ATI that are also really helpful for studying. So when you get them, she's got them. There we go. Make sure you hold on to those.
But there's like 12 that you get. So
yeah, it's huge. It's like this big, the stack of ATI books. So that's about it for ATI. Do you guys have anything to add for that?
Nope.
All right. As far as like how to study for the program and I guess the way that we're tested, it's a little bit different from most classes that you will have already taken. Rote memorization is not going to be, it's not the end all be all in the nursing program. Obviously there's going to be things you need to memorize, like it's helpful to know lab values and have little mnemonics to help you memorize signs and symptoms of certain diseases. But application and critical thinking are probably the biggest parts of nursing school, the biggest things they want you to learn. So for example, like the questions aren't going to be what's the normal range for potassium. They're not just going to ask you the lab value. They're going to make it a little more complicated, like this example question. So figuring out like your highest priority. For example, some questions will be a list of things that you definitely want to do for that patient in that situation, but you've got to pick the thing that you do first, the highest priority. So it's a lot of critical thinking. So do a lot of practice questions on ATI. I find that really helpful. And we talked a little bit about working while in school, and you can work full-time or part-time. You just have to be really on top of your schedule and really on top of planning things. I have a very detailed planner that does not leave my side because I need it in order to survive and keep my job and stay in school. So yeah.
To go along with the working while in school too, if you are going to work, just make sure that either a job that you already have, or if you're interviewing for a new job, like within the hospital or something, make sure that your new employer is going to be okay with needing the flexibility for nursing school. Because some employers have been, nope, this is your set schedule, you need to work around it. And others are fine with working around your schedule. So just kind of know going into the program where your work stands, so that you know what kind of accommodations you're going to need to make for
that. I also wanted to add too, sorry, as far as questions go, you don't have to go back, it's fine. When it comes to math, I know for me, the thing that kind of worried me about going to nursing school was the math part, because I already said I'm not great at math. But luckily, there's only like a couple of formulas that you need to know as far as answering like medication questions, and most of the math questions are, more than anything else, word problems, like figuring out what you need from that question, like what parts are important, what's actually going to help you answer it, and throwing away all the stuff you don't need. So again, it's like all really critical thinking is really, really important. These are some pictures of the campus for Fox Valley, which we have not been in quite a while. But we go there for lab checkoffs, and that's about it these days. It's just to do our skills checkoff. This is the sim lab. So some of these mannequins are pretty cool. Some of them have injuries and stuff. Some of them, we've got like arms to do IV insertions on. And do like dressing changes and trach care. Yeah, so that's how we practice all of our skills. We also have this room where in the room you have a mannequin, but the mannequin, its eyes move and it talks to you. So it's your instructor in another room talking for the mannequin. And it's like a developing situation where you role play what you would do. And it's all of us, it's too many cooks in the kitchen sometimes, but basically it's all of us trying to use our critical thinking skills and figure out what to do to care for this patient. While our clinical instructors in the other room probably having a good time laughing at us. So
it's a really good way, like as awkward as it may seem and feel, it's a good way to kind of develop those nursing skills in a totally safe environment where you're not worrying about the safety of an actual person. If you mess up, like you're not going to kill the mannequin. They're just going to be like, oh, really? Should you do that?
Yeah.
So,
well, you can kill the mannequin, but there's no consequences for killing the mannequin. Talia, when did you want to start here?
Sure. Yeah. Okay. So basically just like the sim lab is like it's in addition to your clinical. So you'll have, I don't know, Laurel, do you have a certain amount that you usually do with people like pre-COVID or because we've only done one.
You mean for sim lab?
Yeah.
I try to bring my class in and do a sim at least once or twice during their class. And I try to hook it up to what we're learning in class. So if we're doing sickle cell anemia, we'll do a sickle cell sim, or if we're doing dialysis, we'll do a dialysis sim. So I try to do that for my class. Every class is a little bit different.
So in place of that, the instructors have gotten pretty creative with, finding lung sounds online and, playing them over the computer and just different ways that we can hear what we might hear in person. But along with that, we have skills checkoffs, which are different things that are going to be required for each class that you take. So it might be a Foley insertion. It could be a central line dressing change, just different things that are going to be pertinent for you to know as a nurse how to do and how to perform them adequately, sterilely. So some of these pictures, thank you. Just give an example of what that might look like. This is the CVC dressing change right here.
We call him Chester.
I like it.
Chester. I use that in my class.
Yeah, so it's just a good way to get that hands-on practice. That way, when you go into the clinical setting, you're keeping the patients safe. They know that you're, They know that you're able to perform it. That's skill. Yes, thank you. And for hands-on learners, it's just really good to be able to practice it and know what you're doing. So that's the CVC. This is where you can practice putting in the NG tube. You can practice trach care. A lot of the mannequins just have different pieces that come out, pieces you can put in and just kind of experiment with. So different things to review for you guys that are in A&P 1, 2, micro. The foundation of nursing is really just that. It's A&P and micro. So things that maybe we wish we would have studied more or just really had a solid foundation on before coming in. You're going to focus on kidney function. How are fluids and electrolytes in the body and your different acid bases staying balanced, whether it's from how medication is affecting that or just different processes that the body goes through. How are things affecting the cardiovascular system? We have the respiratory system. I mean, these are like your core things in nursing. We call this like the ABCs, and it's like the things that you're assessing first in a patient is always like their airway, breathing, and circulation. Like those are your core things that you want to assess in a patient. So you really have to be solid on, your systems. So that includes endocrine, reproductive. Obviously, those are going to be important when you get into L&D right now. That's everything that we're focusing on. For micro, what'd you say?
Sorry, I was just gonna say, I only wrote down the stuff that like has been relevant up through now that we've studied. Like this isn't even the last 3 classes really that are much more, anatomy and like pathophysiology based too.
Yeah. So it's just, I think why we stress this is because every class builds on the next. And so if you come in with the foundation of knowing your body systems, knowing really the physiology behind it, because like they said, it's not just rote memorization, it's knowing the why behind it. If you can come in with that knowledge, you're just going to keep building on it and it's going to make sense. You're not going to have to keep like pounding it into your head every single class you go through.
Yeah, I guess the point we're trying to make too is they're not going to ask you about like the greater trochanter of whatever bone or about your masseter muscles. It's the physiology more so than anything else.
Yeah. So I think that's, for micro infection control, we learn how to put on PPE, take off PPE. That's especially important right now in COVID. You don't want to be transmitting, who knows what from place to place. Good hand washing. That's another skill that you'll check off in 105 is how to put on your PPE, take it off in the correct order, how to wash your hands, just things like that. Learning about bacteria, the different immunizations, vaccinations. That's another skills check off is how to be able to correctly administer that, why we administer that. So someone said, I'm finishing AP and obviously we had no in-person lab. Is it going to be important? Lack of knowledge when I start the nursing program. I feel like as important as the in-person labs are, like we said, if you can wrap your mind around the physiology of, I guess, the processes of those things, you're going to have a leg up. It is important to know certain things that you might see on the cadaver, like where to locate a muscle. You might need to know like the muscles and where to put an immunization. But the core of what we do is that physiology. So as long as you can,
the actual anatomy stuff we have to know is super, super basic. Like deltoid muscle, there will be like click and point questions once in a while for like super, super basic, like way out here anatomy, not the super detailed stuff that you're learning at A&P.
Like it's good to know, like when you're talking about like the renal system, the kidneys, knowing like all of the little nitty gritty of that and knowing like not necessarily where everything is, but just how that can affect like your fluids and electrolytes. I think that's the smallest detail that I've found relevant so far is, your kidneys and when, what it's, I'm blanking on the word right now, but what it's like filtering out and how kidney function affects basically like your cardiovascular, if your fluids are high or your fluids are low. That's kind of the most in detail I've seen as far as anatomy goes. But like they said, everything else has been more physiology and knowing how, if one thing's not working, how it impacts something else.
Mm-hmm.
We're almost done.
So yeah, no, I don't think it's a big deal.
I definitely lied when I said 30 to 45 minutes. I'm sorry.
All right, we've had good questions. So, all right. So how has COVID affected the program? We told you guys a little bit about that. But for us right now, it's been that we've been doing the hybrid learning rather than being in person. We've been online doing lectures, doing exams. Our exams are what we call proctored. Well, not all of them are proctored, but we have like a system that we use just to make sure that, everyone's abiding by a certain code. We have, sign off and in-person clinical. They already touched on clinical a little bit. It's going to be depending on the facility. I think Cassandra, you kind of mentioned all of this, but it is going to be dependent on each professor, whether they're going to have everything pre-recorded or we're going to show up in person to that Zoom meeting for class each day. What else? Like she said, we don't have in person for 105. And I think that's kind of all.
And like we mentioned earlier too, I think Bailey said it, our clinicals being in person is not at the discretion of Waubonsee. It's at the discretion of the hospital. So if the hospital says, you know, no, our restrictions have changed, we're not allowing students, or we do allow students, but only 3 on the unit at a time, or we're having a PPE shortage, so we can't, you know, we can't accommodate right now. That's entirely at the hospital's discretion. So at the moment, you know, at least like our class hasn't had any issues. As they mentioned earlier, you know,
we did have one online clinical.
Yeah. But we do have the limitation, like Bailey said, where we have only 3 people can be on the unit at a time. So we have 6 people at our clinical site. So 3 of us are on the unit in the morning, and then we switch in the afternoon, and we'll do, you know, like case scenarios or other like relevant work to whatever we're studying in class during the remainder of the time. So, yeah.
All right. So before COVID, like they said, we used to do 4 what we would call like a larger exam. Those exams would be maybe like, were they 60 questions, 60, 70?
60 or 70, yeah.
And that was spread out over the course of 8 weeks. Now, during COVID times, we are doing 6 what are considered smaller quizzes over 8 weeks. So every week, essentially, with the exception of a week here and there, because our classes are 8 weeks, we are doing a quiz, and usually the quizzes are around like 35, 40 questions. Like she said, that is kind of, does have pros and cons. But I think most people have been enjoying doing it that way, and it's been working out. So,
I do think Laurel has 7 quizzes.
What'd you say?
I think Laurel has 7 quizzes.
Yeah.
Laurel's nodding.
Perfect.
7 quizzes.
Nikki, no, there are no full-blown exams as of right now.
Correct.
Just quizzes.
Just those quizzes. Yep.
And you have to get that above 80% average.
Mm-hmm. And then you'll have your other
It's easier to do the quizzes, and it's easier to keep track of how your grades are going. So if you're starting to have trouble, we can fix it every week instead of waiting till the end. So I think those quizzes have been very helpful.
They've been nice.
Yep.
So like we said, it kind of doing the hybrid and the virtual learning has given us a little bit of autonomy and flexibility within the program. We're kind of able to structure our schedules a little bit better, I would say, depending on how the course is laid out. For the class that we're in right now, since all the lectures are pre-recorded, we can kind of have the autonomy of figuring out when we're going to do that, how it works with school, how it works with work, how it works with kids at home if you've got them doing Zoom learnings. But like we said, if you're not on top of it and you aren't in good communication with your instructor, if you don't ask for help when you need it, then you might still struggle. So we just recommend, you know, like Laurel said, talking to your instructor. If there's an issue, if you notice that you're struggling, get on top of it. You can pull yourself out of that. You have different opportunities and resources available, so utilize them, and it's very doable. So yeah, that's what I would say for that.
I was going to add something, but it's kind of more relevant to a slide earlier on when we talked about like the grading scale and like the way that questions are worded differently for our exams. So I will share, like, before starting the nursing program, like I had a 4.0 in all of my nursing prereqs. Like I did great in A&P. I was the super nerd in Showalter's class that had like 103%. So I was all about the A&P and micro, but I got a B in nursing 105 just because the questions were not what I was used to. I was used to straight memorization, then just, you know, memorize it, throw it back, and then forget about it. And so 105 was a little bit of like a rude awakening for me, where I was like, okay, I got to change how I'm studying. I got to do more practice questions. I can't just memorize this. I can't wait till the last minute. So if you're in the same boat that I was, where, you know, you're doing great in these classes, just keep that in mind to take the extra time in that first class to study a little more in depth and practice the questions. Yeah. Okay.
Yeah, that's all we have. Do you guys have any questions that you can think of? Laurel, do you have anything that you can think of that you want to add?
I think you guys did an excellent job. As you were going through this, I was thinking, this is excellent. This would have been nice if everybody would have had this when they were in prereqs. So I was quite impressed. I don't see anything else to add on there. Sometimes the concern of what things cost is one thing that people need to understand. There still are, some money things. So understanding you're not just going to have tuition, you're going to have other fees. That's helpful to know ahead of time too, I think.
Yeah, the cost of the ATI was definitely a big shock to me, the $275 every 8 weeks. So that's, I think it's definitely keep in mind.
I think it's a little bit more than that. Depends on the class. I think some classes are like $300, and it depends on the class.
Yeah, I think I've been paying like $292 lately for it. So
it just depends, yeah.
Someone else said, how long will it take to complete all of your nursing classes?
So generally it's a 2-year program. But like we mentioned earlier, it kind of depends on when you start. Like the people that start in August will graduate 2 years later in that May group. But like our class would have started in October and we'll graduate in July the following year. So it kind of just fluctuates depending on when you start. But usually I would say it's 16 months. All right, no.
8 semesters.
I would say I'm the wrong person to ask because I can't even do that math in my head.
Right, my brain.
8 semesters.
There we go.
Any other questions?
I'm just curious about something.
Yeah.
How come that there's really not nursing classes on the summer except the very end of it, like the NUR 275?
Laurel, do you know why that is?
That's a choice by the college. That's a choice that's the way the college set it up. The July class, because we have the 4 cohorts, that's how they do it. They're not going to offer another session of classes. I can't see that changing either. The only thing in the summer, I'm trying to get the pharmacology class to come back in the summer again. Because that was
gone. I was planning on taking that this past summer, and then I saw it was gone.
Yeah, I'm hoping to get it back for next summer because it works really well. But and then that kind of stuff, taking the things you're going to need for your BSN, taking that in the summer. If you need special classes, I know a lot of students do that in the summertime, getting ready for their BSN.
That's what I ended up doing, was taking the couple extra like gen ed types of stuff that weren't covered in just my general associates.
Yep.
And then the pharmacology class you mentioned is not required. It's just extra, and it'll help with the program because we have other programs will have like a pharmacology course. We have pharmacology sprinkled into all of our classes. Like for example, in our OB class, we learn pharm related to OB.
Right.
In psych, we learned pharm related to psych. So.
And then last thing, if you guys don't have any questions, is I know some people were asking, we will post the recording of this. And then Cassandra and Bailey, I don't know if we had talked about if we are able to share the PowerPoint at all.
Mm-hmm.
If we have
share the link for that.
Yeah, I wasn't sure where we were posting this stuff, so.
I'll
definitely send it to instructors to post.
Okay, perfect. So,
these were great questions. You did a great job. Hit right what you need to know. So nice.
All right, thank you guys so much for coming.
For you guys, and thank you for coming. We really appreciate it.
Good luck whenever you're starting.
See you on campus someday.
Yes.
Yeah, let us know if you need anything. We did leave our contact information, or I think Cassandra's.
Yeah, I left it on the PowerPoint. So
if you have,
thank you.
Just shoot them to her, and thank your instructors for us for sharing this. So, I think that's it.
Here's a quick link.
Thank you, Elijah. And there is the link for the PowerPoint if you guys want to grab that real quick.
Yeah.